Steve,
Mr. Regan.
Hi there.
this was not in your board packet, so I am going to pass this around. We need to do a community health assessment every 5 years. That's required from the state is asking us to do this. And so in 2004, Social Services, Public Health, and Unity Family joined together and did a community health assessment. And we are doing that again this year. It's our 5-year annual health assessment. And basically, I'm asking to approve an agreement between Unity Family Healthcare, Morrison County, and the Minnesota Institute of Public Health to conduct a community health assessment. And I had talked to you earlier about the cost. The cost for us, for Morrison County, would be $3,000, and that will be shifted from a position that I am not filling in our budget. And so basically, it's already currently in our budget. I'm just moving it over to help pay for this. And I would need the board chair to sign the agreement.
Mr. Chair, what good becomes of this, I guess, for lack of a better word?
It's used for our, it's used to help us look at what we want to do for planning for our department and for the county. So basically, it's asking the community what are their concerns and what are things that we should look at and focusing on. So basically, we did one in '95, and then we also did one in 2004. So this would be our 2009. So it'll be a survey that's going out. We'll be doing a paper survey, and we're also looking at some other way to kind of getting it out to try to get as many people as we can to fill out the survey and get that information for us.
This is an excellent opportunity to gather qualitative information about how things have improved or gotten worse in, well, there's physical health, there's mental health, chemical dependency, all of these areas we're able to tap into the general population in terms of how they view what has been going on. And as Bonnie said, we now have 3 of these that we can refer back to in terms of where we were and where we are right now as to is the community and citizenry better off from a health perspective than they were 5 years ago or 10 years ago.
And the Tri-County does it too, don't they? Tri-County.
Well, both Todd and Wadena do their own community
Yeah.
health assessment,
Okay.
so basically each county does their own.
Okay.
Yeah, it's a nice partnership also with Unity Family because it's bringing them in, and then they are also putting in some dollars that they have to help pay for this.
Okay.
So moved, Mr. Chair.
I'll second
We
that.
have a motion and a second. This coalition is a collaboration of Morrison County Public Health with community partners such as school districts, law enforcement. You say they will be pitching in something?
No, this is a different.
This is just the paper one, I'm sorry.
Oh, okay.
Yeah.
That's something different.
Yes,
Okay.
so this is the RBA to
Oh.
approve this agreement with the Minnesota Institute of Public Health, and then us and Unity Family.
Okay. Okay, I got you. Okay, we have a motion and a second. Any discussion? All in favor, say aye.
Aye.
Opposed? Carried.
Those are the forms I need signed. Thank you. All right.
Thanks, Steve.
Okay, now Sandra will come up. Now, this is the one that you see on your,
Yeah, okay.
the thing. So this is, the motion is to approve the public health to submit an application for the federal grant for the Drug-Free Community Support Program. And this grant would fund the efforts of the Stand Up For You Coalition, which will work with the communities of Little Falls, Royalton, Upsala, and Swanville. And this is a coalition, is a collaboration of Morrison County Public Health with community partners such as school districts, law enforcement, spiritual organizations, parents, youth, and local businesses. The requested amount will be approximately $125,000, and I had given you the final summary budget this morning, and it actually will be $111,753 that we're requesting from the federal government, and then our in-kind match is that. And I have the full budget if you wanted to look at it. And this grant may be renewed up for up to 10 years. So I guess I don't know if you have questions on this grant. And
Well, that's
again,
the one I was asking about.
Yeah.
There'll be collaboration with the schools and
Yeah.
and they will be kicking something into, or they?
It's part of their in-kind. We're all doing in-kind.
Okay.
So they're basically, when they meet with us, we can count their time. We have, it's a Project Alert. Project Alert, they will be doing with their middle school people, so basically when the teachers teach that curriculum, we can count that time. That's what's the in-kind piece of this.
Okay.
Okay. I don't know if you have any other questions with this. Again, this is an application, so.
Yeah, okay, someone wanna move on this?
I'll move on, Mr. Chairman.
I'll second that.
Any more discussion? All in favor, say aye.
Aye.
Opposed, carried.
All right, thank you very much. Do you
Yep.
have other questions for me at all?
Any questions for Bonnie?
No?
No?
Thank you.
No.
You guys